Welcome back to Hardball. Well, the latest word is that the Senate Finance Committee is going to actually vote on the Max Baucus health care bill this Tuesday coming up. So then what? Will Senate Democrats find those 60 votes to pass the bill? Will House Democrats pass a bill that's looking or lacking the public option? How's this going to happen? MSNBC congressional correspondent Mike Viqueira knows the House, and NBC News correspondent Ken Strickland is over there in the Senate. They are Vic and Strick. Guys, I want to know, I mean, you got to stick your neck out a little bit for me here. This is hardball. This is politics. No BS, no ideology, just pure, cold assessment right now about how this looks without any sentiment or heartness. You first, Mike, with no heart, no sentiment.
Okay. Yeah,
is this thing rolling toward a bill by the end of the year? Is it rolling toward a positive conclusion in terms of a signing of a health care bill that moves public health, the national health consensus further?
I think the odds are that it will, although I'm going to hedge it, Chris. I'm going to say it's not a guarantee by any means. I mean, basically, all this matters, all it comes down to at this point is what will get 60 votes in the Senate and what will progressives and liberals in the House be willing to swallow, because it's very unlikely that they're going to get the public option, robust or otherwise, that they're looking for here. Nancy Pelosi is doing her due diligence with the base of the party. She is putting forth a public option in the House version. Look, here at the White House, and some elements within the leadership in Congress, Democratic leadership, would just as soon that the House take up whatever the Senate is able to pass. And Strick can speak to this, but it appears that they're not going to pass anything with a public option, at least not something that liberals want. Perhaps some sort of compromise that's been talked about now, put forward by Senator Carper of Delaware, where the states can opt in or opt out of a public option. But that's the way it's shaping up right now, Chris.
Well, Strick, you know, it seems to me I worked up there, and you've been working up there all this time, and you know the Hill, and everybody gets so confused about this, especially people that have never worked up there or covered it.
Sure.
You need both houses to agree to something. It ain't complicated. Both houses count. The House is a little faster. The Senate's a little slower. Damn it, that's our Constitution. It's been around since 1776, basically 1783 or whatever. That's the way it works.
89.
So, from the Okay, I know. When they first got elected. Okay, I know. Okay. Boy, you guys are doing it to me. Okay, now the question is, haven't we known for months, despite what happens on this network or anywhere else, there ain't going to be a Senate approval of a public government-run plan? It's not there. The numbers were never there. We always knew it. So so how's this going to go forward?
You mentioned the public plan, and something just happened maybe 3 hours ago that's very telling. A large number of Democrats are sending a letter to Harry Reid and telling the majority leader, we want a public option in this bill that is merged from the Finance Committee, which does not have a public option, and the Senate Health Committee, which does. Only 30 Democrats signed this letter. Chris, you know, you need 60 of anything to pass anything controversial in the Senate. Only 30 Democrats put their names on this letter. Now, leadership people didn't put their names on the letter because, in theory, you don't need leadership people signing letters to leadership. I'll give you 6 more for that. So basically, you only have 36 people who are willing to put their names on a sheet of paper that says, Ms. Majority Leader, we want a public option on the bill that comes to the floor next month. That doesn't mean the people who haven't signed it aren't for the public option, but that's where things stand right now anyway.
So even in the Democratic caucus, it's split about even.
It's more than split. And there are 60 people in the Democratic caucus. There's 60 people in the Democratic caucus counting the independents. Only 30 have put their name to this letter. Throw in six leadership people. You're still 24 people short of having 60 votes for the public option.
So
now,
a lot of this has been... Yeah, okay, so a lot of this has been talked. So, Vic, you pick up on this. Given the fact that the Senate's not going to approve a public option because they can't get anywhere near 60.
Right.
And by the way, I'm wondering were they ever going to get 50. And all these guys, we're going through reconciliation, we're going to ram it through. They never had 50. Okay, that's just my hunch, my belief. So now we go to the fact there's going to be a conference between the House and the Senate. There's going to be a rupture here. The House liberals will want to get what they do. They'll get it out of the House. They'll go to the Senate bill. What's going to happen when those two meet?
So the question becomes in both the House and the Senate, what are liberals willing to accept? What is Jay Rockefeller willing to accept? What is Ron Wyden willing to accept? What are Lynn Woolsey and Raul Grijalva and the rest of the liberals, the liberal leadership in the House willing to accept? The liberals, it's widely believed in the House of Representatives, are not going to leave a $900 billion bill reforming health care, something that many of them have dreamed about all of their careers, have fought for all of their careers. They're not going to leave it on the table. They're not going to walk away. They'll take as much as they can get, but they're not going to live or die by the public option, notwithstanding all the letters have been written about a robust public option, about the Cadillac plans and their opposition to the Cadillac plans, that tax on the plans that are worth more than $8,000 for individuals. That's what it's going to come down to, Chris, and it's going to happen probably before Thanksgiving in the next 5 or 6 weeks.
Well, let me get back to Ken on this question of, I want to know something I used to know, and I want to know if it's still true. Do you feel the strength of our president up there on the Hill? Do you feel, when you work up there and you talk to the members and the staffers, do you sense the strength of Barack Obama or not? And that's a tough question.
I think you can say that you can in certain areas. I mean, nothing moves a member more than a phone call from the White House saying the president is on the line. But at the end of the day, it comes down to votes. And for a lot of these senators, especially those who are up for re-election, especially those who are from red states, it comes down to getting re-elected. Yes, some people do stand on principle, but let's not be naive about this. For some people, it comes down to re-election. One Democratic senator who was talking to me in confidence kind of put it this way. The president's going to either have to choose between his liberals or his moderates. And at some point, it's going to come down to votes. The votes are probably there for something that is not the public option, maybe a co-op, maybe something that Viqueira talked about regarding the Carper proposal. And so this Democratic senator explains it this way. The president's going to have to reach out to those liberals and say, look, maybe it didn't go the way we wanted it to go, but I'm going to get reelected, and we can go back and get the public option later. But if we don't do this now, we're not going to get anything. That's the way he kind of sees it. It might play out. We don't know that.
Inside.
Right.
I really appreciate it. So it comes down to the fact, can the president bring this deal together by convincing the liberals? You'll have a better chance later if we get this now. Right, Vic?
Well, you know, their fortunes are going to rise and fall in the fortunes of the president, their political fortunes. And to the extent that the White House can make that case, they're going to have a success. Clearly, if this goes down in flames in the Congress run by Democrats, for how many years, Chris, did they make the argument to Democrats, to their voters, to their constituency, give me 60 votes, and all of this is going to be taken care of, whether it was the Iraq War, whether it was health care, whatever. No excuses now. If it doesn't happen, they crash and burn, and they're going to pay a price in the 2010 midterms, and that is the case that they're going to make here.
And I agree with that assessment as journalists from YouTube fellows, and I also agree it's a political assessment by Bill Clinton. It's the same assessment, and I would argue if you're going to be the party that believes in government, which the Democrats do believe more than Republicans do, they believe in positive government, you have to be able to govern and prove that you're effective at governing. And if you blow it, you can't say you believe in government because you've failed at government. Thank you very much. That's a little redundant, but I think I made my point. Thank you very much. Mike Viqueira, Ken Strickland.